We are a 43-bed pediatric intensive care unit for patients from birth up to their early 20s. We're a medical and surgical ICU. We host patients who need invasive ventilation or complex medical management, and we also care for surgical patients who require ICU-level treatment, including liver and kidney transplant recipients. Our nurses respond to the hospital's Level 1 traumas and serve on the Code Blue and Rapid Response teams, so we are a safety net for the organization as well. PICU nurses become experts in intensive care skills, including working with intravascular and intracardiac lines, intracranial pressure monitoring, mass transfusion protocols, fluid resuscitation, and more. We also have specialty teams for CRRT, continual renal replacement therapy, and ECMO, extracorporeal membrane oxygenation. Our entire orientation process can take a year or more to complete. We start with a 2-week boot camp of intense classroom learning and then transition into 3 months of working with a preceptor on both day and night shift to learn how to take care of Tier A or lower acuity patients. You'll practice independently for a bit before moving into Tier B to get experience caring for the highest acuity patients. We don't always have those patients in the unit, so the time to complete your Tier B orientation varies. No matter what, you'll never be learning alone. We have a resource nurse every shift to help you at the bedside and mentors to get you through the tough days. You can start working on your CCRN certification after 1 year of experience. You can also become a trauma-certified nurse through our own trauma ICU course. If you're interested in ECMO or CRRT, you can apply to become a part of those specialty teams and be trained in those procedures. There are plenty of leadership opportunities, including becoming a preceptor or joining committees on hospital-acquired conditions, neurocritical care, burn care, and more. In the PICU, we do 12-hour shifts, 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m., 24/7, 365. Our staff self-schedules after initial orientation, and everyone has weekend requirements per scheduling period. During orientation, you switch between day and night shifts, but after 1 year, you go to only night shifts until a day shift spot opens up if you want one. Our normal patient load is 1-to-1 or 1-to-2. With very complex cases, sometimes it's 2-to-1. We have a multidisciplinary rounding process during the day shift that the bedside nurses play an essential part in. Rounds during the night shift are more limited check-ins. The PICU has around 200 nurses, 24 to 25 per shift. Many of them are new grads, but we have plenty of experienced nurses on staff to learn from. We have a very strong team dynamic. People are always helping each other out. We have close relationships with our intensivists. We work hand in hand, and they are very supportive of our nursing staff. PICU nurses are detail-oriented and direct communicators. They also have a lot of empathy and resilience because it can be a very hard place to work. We care for the sickest patients in not only the metro area, but the region. The acuity is extremely high, and so are the stakes. We take care of each other's emotional well-being. We have ASAP debriefings after complex situations and medical debriefings with our intensivists. We encourage team members to take advantage of the employee assistance programs for mental health, and we are sensitive with assignments if someone just had a difficult experience with a particular type of patient and needs a break. But what helps the most is our community. There's nothing like getting a call or a text after a bad shift from someone who understands what you're going through. Caring for critically ill kids and supporting them back to health is so rewarding. But we recognize that not everyone survives. It's also meaningful to help families make impossible decisions and say goodbye in a dignified way. The best part of working in the PICU is seeing our team come together and rally behind patients and help them move on to the next step in their journey back to health. That's the why behind what we do.